What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe. Hopefully your week is going well so far. If you had to take a COVID test, flu test, or a test for any other virus, I hope you have tested negative. If you did test positive for any of the viruses, I hope you have a full and speedy recovery with no long-term and no long COVID issues. It is time now for the Friday edition of the Virus Update for Friday, February 21st, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. I give you the latest news, data. Sometimes we talk about studies of all these different viruses that are circulating, not just in the United States, but around the world. All to keep you safe and informed of what is going on. Does this sound like something that you want to be informed on? Just subscribe to my channel down below. Help me reach 7,000 subscribers. And help me reach my ultimate goal of 10,000 by the end of this year. Of course, give this video a thumbs up. Oh, so many people did that yesterday. We met our goal of 200 and then some. Let's try for that again today. Share this video with anyone you know. Hit that notification bell and leave your comments down below. You'll be surprised if you're new here. The comment section of my videos is actually turned into a community. I think it's fantastic. We see people checking in almost every day. It is great. I love reading your comments. Alrighty, let's get into today's update. We do have quite a few things to get through today. In the news category, you're going to see some data maybe a little bit sooner than you would in the program. And then you're going to see a lot of data at the end from the CDC because it's Friday. And yes, we are getting CDC updates again. Hopefully they stay, but you'll see a little bit of an announcement here, somewhere in between. Nothing me related, but announcement from a state, I shouldn't say a state, a city that they're scaling back updates. Yeah, I mean, slowly but surely, I think we're going to lose more data, especially once respiratory virus season ends. I think we're going to see less dashboards updating. I hope that's not the case. Alrighty, let's get into this, shall we? Ohio records first juvenile flu-related death as hospitalizations continue to rise. We've been seeing a lot of the 0 to 18 category deaths pop up with flu this year. More than we would like to see, more than there usually would be. We don't like to see anyone die from these viruses, but unfortunately it's happening in all ages this year. An Allen County teenager under 18 years old was the first influenza-related pediatric death of the season as Ohio flu numbers continue to surge past the 5-year average, according to the Ohio Department of Health. Sadly, the tragic death reminds us that influenza, though common, is a serious health threat, says Ohio Department of Health director. Yeah, this is not good, and take a look at this. There were, wow, this is really bad. There were 2,470 flu-related hospitalizations statewide in the most recent week of data from Ohio Department of Health, showing a 25.8% increase over the previous week. The 5-year average for this week in the flu season is under 500 flu-related hospitalizations. Let's just think about that for a moment. They still saw a 25.8% increase in the number of hospitalizations for flu, and last week was already the worst in many, many, many years. Yeah, something's going on here. We're going to be investigating what's going on. There's a special video that's going to be coming tomorrow. As I said in the past, I'm going to be taking day off. Well, there's a special video which I'm going to be making this evening. We're going to be talking about just what's going on. Please look for that tomorrow. It's a very important video because I'm seeing so many people question what is going on. Why is everyone sick? And the numbers in Ohio, it really shows. And it doesn't just have to be flu. It can be anything. There's a heck of a lot of everything going on, more than ever before. Look for that tomorrow. Moving on, the Virginia Department of Health have reported additional pediatric flu-related deaths this respiratory season. 4 children have now died due to complications of influenza. Yes, more pediatric deaths. This time it is in Virginia. I mean, yeah, I'm not like seeing this. Look at this. Flu cases up in Rhode Island by 50% from last season. 50%! That's a humongous increase. Why this year is worse than others? Since last September, over 5,000 people have tested positive for flu at Rhode Island hospitals. That's just people that felt sick enough to go to the hospitals. That's not including all the other cases. And mind you, Rhode Island's a tiny state. Yeah, things are just not going well when it comes to flu. And like I said, we're going to be investigating this a little bit tomorrow. We're not going to have the full answer, but we're going to have some of the answer for you tomorrow. I think those who have been long-time subscribers of my channel know where I'm going to be coming from with that. I'm going to leave you hanging till tomorrow. Alrighty, this week's flu versus influenza report. Someone asked yesterday about flu deaths. I don't have the total number for the full season so far, but what I can give you is this from Gregory Travis, which he posts this stuff on X quite often, and looks like he's also on Blue Sky. I got to make sure I follow him there. And here we go. January of 2025 was the first time in history that more people died of influenza in the United States than COVID. Wow. January 2025 influenza, 3,958 deaths. COVID in January was 3,925 deaths. Those numbers are preliminary and will rise some more. And take a look at the chart here. You can see here there have been quite a few deaths of influenza, and those numbers are likely to change some. And you're probably thinking, oh, see, COVID's just a flu. No, COVID still goes on to cause long COVID. COVID deaths are still bad. And guess what? At some point later this year, there's going to be yet another wave of COVID. At that point, probably the total number of deaths in the United States will surpass the total number of influenza deaths this year. Should, unless something changes with influenza where it continues a little longer than usual. Moving on to this. Study finds hospital occupancy rates up since COVID-19 pandemic. Colorado better than U.S. average. That's right. The number of beds being used in the United States is up since the COVID-19 pandemic. Here's another clue for tomorrow's video. Yeah, there's more hospital usage going on now, but there's many different reasons. Let's read a little bit of this. Post the COVID-19 pandemic, the U.S. hospital occupancy rate has climbed 11% compared to pre-pandemic levels, largely because of a national reduction in staff beds. A new UCLA study has found from 2009 to 2019, the U.S. had on average 802,000 staff beds. That number has dropped to 674,000. Gee, I'll tell you one thing that comes to mind right away. Wonder how many of those people that were working there retired because of COVID, got sick with COVID, and now have long COVID. Think about it. Yeah, it's a pretty bad thing. All right, something else that's bad. Did anyone watch the Saturday Night Live 50th anniversary special last when was it? Last Sunday night? Yeah, it turns out COVID made an appearance. Yep, there was the special guest was COVID, or surprise guest. Although if you follow this channel and if you're COVID cautious, should be no surprise to you that COVID had entered the building. Steve Martin says that Martin Short and Maya Rudolph have tested positive for COVID after attending the Saturday Night Live 50th anniversary special on Sunday. And take a look at this picture. Oh, yeah, it looks like they were giving COVID to each other. And who knows? I didn't see anybody masked there when I watched. I didn't watch the whole thing. I did not see anybody masked. I do remember recalling some coughing going on in the background. So there may be more people who have COVID there, and they're just not going to disclose it. Or maybe it'll come out over the weekend. I don't know. And then there was someone else, I believe, that did not show up to the show at all because they had flu. So they were actually responsible enough to not come. But yeah, COVID made an appearance at Saturday Night Live's 50th special. Both those names, of course, will make it into my COVID positive archive. Study reveals women far more likely to develop long COVID than men. Gee, how about that? That's something that's not good. It's not the first. I don't think this is the first study we've heard about this, and we don't have a section in our study archive for just COVID's effect on women. Should we? I don't know, but we've seen several different studies before that showed things being worse for women than men, and you know what? It affects everyone differently. It affects children, men, women. Everyone gets impacted different by COVID. It impacts, some countries are being impacted different. There's several different interesting things that we are finding about this, and none of them ever seem to be any good things. We haven't seen much good news in a while. It's been a pretty bad winter. Well, the only good news would be that there's less COVID deaths than influenza, but is that even good news? I don't think it is. I mean, there's still a lot of people dying, and if this was pre-2020, we'll say 2018, yeah, we wouldn't have all these COVID deaths added on top of all the flu deaths and RSV and pneumonia, this virus, that virus. It's bad. All right. News. CDC reports Michigan and Ohio reached the highest flu-like illness visits in 15 years. Yeah, Michigan, too. We showed Michigan yesterday, and take a look here, and we'll show this map again in a little bit at the end of the video because we want to play around with the weeks, and there's some things that you need to take note of. And you can see here, activity levels are very high. In several places still, acute respiratory illness. My state, Pennsylvania, is still really high. Oklahoma. You can also see Kansas is still really high. And I would like to know the death rates in Oklahoma because remember, you got to acknowledge Oklahoma has had, I haven't seen any new updates lately, but last update I saw, Oklahoma has one of the highest long COVID rates in the United States. I would like to know how people fared out who have long COVID in Oklahoma this respiratory season because this has been a particularly bad one. For the fourth week in a row, influenza-like activity remains in the top 19 since 1997. And of course, flu itself is now the worst since the 1990s. Yes, things are really going bad. Second highest in New England since 1997. Previous week, yeah, things are just not going good whatsoever. And here comes the good news, bad news with LA. Their COVID numbers are not terrible. Daily average cases 95, daily average deaths 2.1, daily average COVID positive hospitalizations 334, but then we come down to this. LA Public Health will end posting weekly COVID-19 information effective March 1st, 2025. Select data on COVID-19 will continue to be available on our respiratory illness surveillance website. Public Health will continue to monitor COVID-19 and issue notifications as needed to update the public on any potential changes in COVID-19 risk in Los Angeles County. So we'll see if the website will continue to update, and it's looking like it will continue to update. So that's good. I mean, they'll still have that, but they're just not going to post this on X. And to be honest with you, I forget to add this in sometime. While we're at it, let's just go to the LA dashboard now. Usually this would be towards the end of the Friday video. Hospitalizations, you can see overall dropping. Deaths, yeah, that went up slightly, but it also has come down. So that's not terribly concerning. Cases is dropping. How about the positivity rate? It's just dropping slightly. Wastewater's down slightly. Emergency department visits are also down slightly. Alrighty, we do have a last-minute addition in the news, which I was just alerted to. Basically, this is breaking news. The measles outbreak in Texas rises to nearly 100 cases now between Texas and New Mexico. So, yeah, that measles outbreak, actually, let's click on this. The measles outbreak continues to get worse, and we can see here the measles outbreak in rural Texas has grown to 90 cases across 7 counties. The state health department posted online, and 16 people are hospitalized. In neighboring eastern New Mexico, the measles case count is up to 9. Though state public health officials said Thursday there's still no evidence this outbreak is connected to the one in Texas. So here's my problem with this. If there's no evidence that it's connected, then we're seeing here that these outbreaks individually can grow rather quick at this time, and that's not a good thing whatsoever. Alrighty, moving on now from today's news. Reminder, my website is datareport.info. There's a whole bunch of information. You'll see more about my website in tomorrow's video that I'm going to be working on later this evening. In Canada, the viral activity level of COVID-19 is moderate. Flu A is high. Flu B is moderate, and RSV is high at this time. All right, we have to take a look at what's going on in Pinellas County, Florida. And we can see here, yeah, a sick person is showing up. Wow, 1, 2, 3, 4 times. There's still quite a few people sick down there. I mean, that's just a snapshot of right now. So if I showed you, various different times of the day, who knows? We may still see quite a few calls. Taking a look at what is going on with air qualities across the United States, if we can. I think this page may have froze up on us and everything is grayed out. We'll see here. But generally, air qualities are not terrible. Places where it's still fireplace season are having some problems. You can see the Great Lakes, still the West Coast, but we've seen days worse than this, so I'm not terribly concerned today. Moving on. In Philadelphia, yesterday there were 771 EMS incidents reported. Taking a look at what's going on right now outside of Philadelphia, in the surrounding counties just to the northwest of the city, we can see in Montgomery County, there are some calls going on right now. 16 EMS calls, respiratory emergency, cardiac emergency. What we do not see during today's update is cardiac arrest. Thank goodness there was one earlier. Can we make that 2 for 2? Can Chester County have no cardiac? Well, unfortunately, there we go. Cardiac arrest in Chester County right now. I'm telling you, how many updates in a row has this been that we see cardiac arrest in at least one of the CAD systems, computer-aided dispatch? Not a good thing. Taking a look at what's going on with the hospitals in Pennsylvania, and I can actually report some good news here. Look at South Central Pennsylvania, all green. No problems with the hospitals. Southeast PA still has some problems. Lehigh Valley, parts of Northeast PA, still some problems. But overall, not as bad. New Jersey, not as bad. And we can see here, a couple hospitals here with issues. And is there another one on the bottom? Yeah. But again, New Jersey's not as bad as well. They're past the peak of their hospital issues as well. I'm happy to report on that. Taking a look at what's going on with Walgreens this week, the COVID positivity rate nationally is 10.9%. The flu positivity rate this week for flu A and flu B is 6.01%. Alrighty, I thought we would take a look at some wastewater on wastewater scan because we're not going to look at this too much tomorrow. We will probably have wastewater Sunday, but given that we're doing a pre-recorded video for tomorrow, kind of a special, there may be a lot of news that we have to report on Sunday. It's possible, since we're not doing a regular news day tomorrow. Take a look here. We can see here, nationally, COVID, aside from this wonky movement, there's actually a little bit of an increase. We'll have to see if that holds or corrects next week. I'm skeptical to think that's happening. It is possible it's happening because of the LB, that new LB 8.1 variant. Well, I'll show you that one in a moment. Sometimes there's so many variants, it's hard to remember all the different names and combinations. RSV is still high, but it's dropping. Influenza A finally looks like there's a peak, and there's good agreement from the CDC. You'll see that in the new data. Influenza B is low, but you know what? It's still rising, and I should mention Influenza A, though dropping, it is still high. Remember what I said yesterday. We still have to go through the backside of the wave, so there's still going to be a tremendous number of cases. Don't think it's over with because it's starting to drop. You can still get Influenza A. You can still get hospitalized. All those things can still happen, and we're still going to see the death wave continue. Because just like COVID, you know how COVID, we often see the last lagging factor is deaths. Well, it's the same thing when it comes to influenza as well. HMPV is rising somewhat. Norovirus is dropping. See, I told you, it's still bad. I just heard an ambulance go by. It's constantly ambulances going by here anymore. Norovirus is running high at this time, and I hope that little uptick before the wonky movement is wrong. I hope it's not going to go up again. But you know what? To be fair, we have not seen a big, tremendous drop yet. I hope next week's the week we start seeing that. Taking a look, well, let's go to regional trends, actually. Taking a look at the regional trends here, you can see for COVID, just about all the regions are dropping. The West, it's not really doing much of anything. And we can see, aside from the wonky movements, again, there are the Northeast, a little bit of a rise. The Midwest, maybe a little bit of a rise, but overall, I'm not terribly concerned yet. If we see another week where everything's going upward, then I will be concerned. RSV overall has been dropping. Some places the RSV drop has slowed down. And we can see here for Influenza A, just about all regions are now starting to drop. Influenza B, again, you get the picture here. I mean, we did the national level, but there are a couple regions that are being stubborn, and I'm not terribly concerned once again. I think we're coming to the backside of the virus, but who knows? I mean, that second peak, out of nowhere, up we went again, so we'll see what happens. Take a look at this. Here's the CDC update wastewater for COVID, and we can see the national level. Let's look at that first. National level is starting to drop. It's actually down to moderate now. That is some fantastic news. When we take a look at the Midwest, yeah, the Midwest it's going up again here on CDC. That is a little concerning to see it doing that here, more so than wastewater scan, which can be really radical. So maybe this will get corrected and it'll start dropping again next week. When we take a look at the South, South is starting to drop. It's moderate, and I should mention the Midwest is still in the high category. Taking a look at the Northeast has now started dropping again, and the Northeast is actually into the low category now, which is really good. We take a look at the West. The West is dropping, and the West has gone down to the low category. as well. And we can see nationally moderate levels for COVID at this time. And we'll take a look more at this map on Sunday, taking a look at hospital capacity here. And we can see hospital capacity in the United States, 74.7% of ICU beds are being used. And when it comes to actual regular beds, 76.4% of beds are being used. The latest COVID variant is XEC, which is at 37%. LP.8.1, that's the variant I was trying to say earlier, is at 31%. And we do know in some states, such as Pennsylvania, the percentage has already taken over XEC, but there's so many variants, that's one of the reasons why it's done it, and it's not at a very high percent. And taking a look at this, respiratory illness data channel, nationally respiratory illness causing people to seek health care, it's listed as high at this time. All right, take a look here. Here's the influenza-like illness activity map, and you can see here, there's some interesting things. Well, purple still shows up in Maine, New Hampshire. It's showing up in Massachusetts, South Carolina, Ohio, Michigan, showing up in Nebraska, Kansas. It's also showing up in Oregon, and it's even showing up in Washington. Still, I know it's problematic in 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 states are still at the highest level of purple. But then there's still very high shade below that, and another very high shade. So there's still a lot of states that are very high at this time. But let's reverse a little bit. Draw your attention to South Carolina. So on January 18th, South Carolina went purple. Let's count how many weeks they have been in the purple. That's 1, 2, 3, 4, 5 weeks now in the highest level of influenza-like illness activity in South Carolina. That is just ridiculously bad. You need to take these viruses more seriously, South Carolina. My goodness, that is just terrible. All right, hospital emergency department visits for people who are diagnosed with COVID-19 in the United States overall is still dropping, but at the very end of this, there's a little bit of an increase. We're going to have to keep our eyes on that. That's something that is something, it's not a big concern yet. We'll have to see if that leads to anything next week. If it does, this would not drop as fast, or we could just see where it shifts to start dropping again. We've seen that happen before during the downturn. You can see in the past, it spiked up a little bit and then right down it went once again. So hopefully that would be the case with this. Taking a look at what is going on with epidemic trends, we can see here when we look at influenza, it is likely growing in Maine, where Maine actually saw the level of viral activity. The influenza-like illness map, you actually went up higher this week. New England's getting hit pretty hard when it comes to flu right now. And we also see growing now in Tennessee, likely growing in Montana, California, Alaska, and Hawaii as well. Then when we take a look at COVID, just about everywhere is either not changing, not estimated, likely declining, or declining. Nowhere is growing or likely growing at this point, with exceptions to Hawaii. I just noticed that. Hawaii is likely growing, but everywhere else is fine at this time. And remember, Hawaii got hit really hard last summer. It's been a long time since last summer, so maybe some of that immunity is starting to wear off. All right, taking a look now at New York State. This is where I think we're going to end today. New cases reported, 1,215 new cases. And I have to show you something very interesting going on in New York State. And let's do statewide first. We can see here the hospitalizations. There's 800 people in the hospital, 77 people in the ICU. That's dropping on the statewide level. But you can see it hasn't been the typical fast drop. Well, there's a reason for that. One reason, anyhow. There may be others. Take a look at New York City. New York City's never really peaked. New York City is still overall rising for hospitalizations. Now, it's not a huge giant number like past waves, but 317 people in the hospital, 35 people in the ICU. It's just been a steady increase. And this goes back all the way back to November, and then they saw a big increase at the start of the year. So, yeah, it's something we're going to have to keep an eye on. And you can even see when we take a look at hospital admissions in New York City. Overall, they have not really started declining fast yet. They're declining a little bit now. Maybe that's going to peak relatively soon. Let's take a look at Long Island. Sometimes Long Island does follow New York City. And, yeah, Long Island hospitalizations, thankfully, they are starting to drop. Alrighty, folks, that does it for the Friday edition of the Virus Update. I hope you enjoyed this update. We will have another video again tomorrow. And the topic for tomorrow is going to be, what the heck is going on? Why is everyone always sick? I'm sure you've heard it. People are always saying, why am I always sick? What's this? What's that? I mean, yeah, we're going to talk about that tomorrow. I'm going to give you one potential reason of what it is. I think you know what it is. If you enjoyed this update, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, and of course, leave your comments in our lovely community down below. I will see you all again tomorrow, and of course, again on Sunday as well. Sunday will be a data-filled news update, where we'll go through all the news of the weekend. Until I see you again this weekend, stay safe, everyone, and have a fantastic Friday night. Thanks for watching.